And the next speaker is Dr. SHAN Fei, MD, the Radiology and Nuclear Medicine Chief Physician Master Advisor, Chief of Radiology, Shanghai Public Health Clinical Center. The topic is application in COVID-19 epidemic.
Hi everyone, my name is SHAN Fei and from the Department of Radiology of Shanghai Public Clinical Health Center. Today I'd like to present my topic, MR application in COVID-19 epidemic with you. My presentation includes the following 4 parts. First is the background. Second is MR standard operation procedures for COVID-19. And the third is MR application in COVID-19. And the last is the prospect of MR application in post-academic area. I believe you are already familiar with COVID-19. The virus that causes novel coronavirus pneumonia was named SARS-CoV-2 by the ICTV, and the disease caused by the virus was named COVID-19 by the WHO. We know the patients with COVID-19 and systemic patients may be both the source of the infection. At present, scientists have found that the infection rate is higher than SARS and MERS, and the current fatality rate is lower than SARS and MERS, but the fatality rate is maybe 10 times higher than the H1N1 infection. Internationally, the current epidemic situation in foreign countries is much more serious than that in China. The latest data shows that the total number of confirmed patients is about 2.2 million, and the total number of deaths is over 150,000. The epidemiological characteristics of COVID-19 are as follows. The incubation period can be long or short, ranging from 3 days to 24 days. Compared with SARS and MERS, COVID-19 is highly infectious. Nowadays, research and evidence indicated that it can be transmitted from person to person. Existing studies suggest that the transmission may be through respiratory droplets and contact. Existing research of mechanisms indicated that SARS-CoV-2 mainly attacks alveolar epithelial cells. It is found that the expression and the replication of SARS-CoV-2 are related to ACE2. It may attack human lung, heart, esophagus, kidney, small intestine, blood, and other organs through ACE2 receptor. Based on the current research, COVID-19 can cause multiple organs diseases through the ACE2 receptor. When it is severe, it may lead to series of complications such as myocardial injury, acute liver kidney failure, circulatory failure, and other multiple organ failure, stress ulcer, and ARDS and septicemia, septic shock, metabolic acidosis, difficult to correct, and coagulation dysfunction, immune system change, and so on. After treatment, most patients can back to normal, but some severe and critical ill patients may have some sequelae. First, the lungs may produce organization pneumonia and pulmonary fibrosis, which will bring the chronic pulmonary function damage during COVID-19 prognosis. Second, for cardiovascular aspects, it may cause some diverse effects such as epicarditis and arrhythmia, and the kind of cardiovascular damage may last long. Currently, there is no relatively detailed research results. Third, it may cause liver damage, but there is no research on whether it is short-term or long-term liver damage. will be caused while using some medication. Fourth, it may lead to femoral head necrosis. According to the previous experience of SARS treatment, many patients got systemic glucocorticoid therapy. The excessive hormone use can lead to femoral head necrosis. At present, we do not know the possibility of femoral head necrosis in patients with COVID-19. In the second part, I will introduce the MR standard operation procedures during the COVID-19 epidemic. We are the only hospital in Shanghai designated for adult patients with COVID-19. In order to improve the imaging examination method, our hospital also attempts to use MR to perform a series of imaging examination on patients. The first step of the patient's examination from the isolation ward to the MR room is to transfer a single patient via dedicated negative procedure ambulance, which is dedicated to the person. Each patient is assigned to dedicated vehicle. Our hospital has opened two accesses for all the patients to enter the MR room. One is dedicated accesses for COVID-19 patients, and the other is for ordinary patients to use normal access to enter other MR room. These two accesses are completely isolated, and we ensure a certain distance to avoid contact and cross-infection. After being transported to the radiology department building, the COVID-19 patient enters the MR room through a dedicated passage. Our hospital chose UMI 780 of UIH as the dedicated equipment for COVID-19 patients because COVID-19 patients carry an active virus. During the epidemic, the device is used for COVID-19 patients only. Other ordinary patients will use equipment from the other MR room. During MR examination, considering the physical condition of COVID-19 patients, fast and high-quality examination is needed for COVID-19 patients as some are relatively weak. Well, UMI 780 is more convenient to operate. The application of faster sequence is good, and the clinical imaging quality also has very high resolution, so we can choose the device as a dedicated device for COVID-19 patients. In terms of the protection for MR operation room, in addition to the use of dedicated access and equipment for patient management, our hospital applies some special protection procedures, and the characteristics of the operation room are quite different. For example, a special technician in the MR examination room comes out of the isolation ward to take charge of the patient's pickup, patient's positioning, and the connection of the coil. The technician will check patient with BSL-3 standard. The technicians in the operation room can be protected with BSL-1 standard because the operation room and the examination room is completely enclosed and isolated. In addition, a special clean access from the operation room to the department is opened for MR staff only. On the other hand, in the protection of medical personnel, traditional scanning requires patient positioning, enter the laser beam localizer, laminar positioning, perimeter positioning, and the protocol conform to star scanning. While in our hospital, the technician with BSL-3 protections helps the patient to set up the position, and then he can confirm the scan protocol and start the inspection. Therefore, with one click, a movable bed can move into the magnet and finish the scan, which reduces contact and the risk of cross-infection. In terms of technology, the use of compressed sensing rapid scanning technology can effectively shorten the scanning time, improve the efficiency of medical personnel with PPE, and reduce psychological and physical pressure. Disinfection and faster scanning measures are recommended for the MR scanning. After working half day, 75% ethanol is used for the disinfection in the operation room. At the same time, a very important point which may be easily overlooked is that the doors of the equipment room and the operation room also needed to be closed, because the equipment room and the scanning room share an air conditioning system. There will be air circulation between these two rooms under the requirement of hospital infection control. The virus might exist in the examination room and the equipment room, so the entry and exit access between the operation room and the examination room, as well as the entry and exit access between the operation room and the equipment room, need to be completely closed to ensure the operation room is isolated from the other contaminated areas. In addition, in terms of infection control, after the COVID-19 patient completes the scan, whole MR department facilities are disinfected around the clock. Every night, we need to use 75% ethanol to disinfect the machine chair, core, door handle, operation button, sickbed, table, and chair in the operation room and other places and other objects touched by medical staff and the patients. At the same time, disinfect the floor of the department with chlorine-containing disinfectant. The same process is done every day at home. Next, I'd like to talk about the preliminary MR research in the field of anti-epidemic prevention and control. I will mainly aim at the following parts. First is the use of MR imaging for COVID-19 patients' lung, and then the cardiac and sinuses MR imaging. UMI 780 used compressed sensing technology. The CS technology has obvious clinical advantages during the COVID-19 epidemic. The ultra-fast scanning is conductive to MRI lung imaging and cardiac imaging. It can greatly reduce the scanning time, improve the medical staff working efficiency, and reduce their energy consumption. Meanwhile, this technology can reduce the doctor-patient control and minimize the cross-infection. As we all know, it is a great challenge to do lung MRI imaging with traditional equipment and sequence, as this is related to the physiological characteristics of the lungs. The first reason is the low hydrogen proton density and the short T2 star attenuation time of the lung tissue, which makes it difficult to conduct the lung imaging. Second is cardiac and pulmonary motion. Micro motions such as heart, large blood vessels and respiration, and micro motion such as blood perfusion and seminal diffusion limits the imaging mode and imaging resolution. Third is the field uniformity of MR imaging. Due to the influence of gaze and tissue, the local field uniformity is poor. Therefore, the MR lung imaging is not very good with traditional MR devices and sequences. Currently, the UTE sequence, such just ultrasound T1 echo sequence, solves challenge of MR imaging for short T2 star and low tissue density. We have done the study of UTE sequences in the lungs on other devices. According to previous studies, UTE imaging can observe the pathological features of systemic cystic fibrosis done by CT. Therefore, we use UTE sequence to do some research for selected COVID-19 patients. We can look the following cases. This is a common case of COVID-19 patient on CT images. Patch GGO can be seen in the right low lung. In the second row of MR images, the UTE sequence is in the low right corner. We can find a relative equal signal in the corresponding place. For T2 imaging, the lesion shows the obvious high signal. For HIST sequence, there are multiple patches in the upper lung. In this case, it can be seen that the pulmonary MR scan with UTE sequence is basically similar to the lesions in the CT imaging, which has a comparable and good correlation with the CT imaging. This is the second case. Patching abnormal signal shadow can be seen in the lingual segment of the left upper lobe. In the first row, CT imaging shows the lesions clearly. At the same time, similar lesions can be seen on the second row of MR imaging. The corresponding size, shape, and hole distribution can be clearly displayed. It can be seen that using UTE sequence is a good complement to the CT scanning imaging. In addition, the diagnosis and follow-up for some special patients, such as children, pregnancy, MR can be used as a supplement for CT, or even replace CT for lung examination. This is the third case. We can also see the patch GGO in the lower lobe of the left lung. Compared with MR imaging, we can see some patching signal on the UTE sequence, and on T2 imaging, patch parts show high signal. For syrinx, in addition to the UTE scan for the lungs, MR has advantages in cardiac imaging. We also conducted preliminary examinations in some COVID-19 patients. This patient has done CMR after observing the increase of myocardial enzymes. On the left is T2 imaging of fat suppression. You can see a diffuse T2 high-intensity signal in bottoms of ventriculus and the upper part of interventricular septum. The slightly higher signal of T2 indicates myocardial edema. At the corresponding position in the delayed enhanced imaging, the higher signal of patching and striping can be seen, suggesting that the patient may have myocarditis caused by COVID-19. For other COVID-19 patients, we also did a preliminary examination of nasopharynx and sinuses. In this case, the patient's naropharynx mucosa is diffuse swollen, which can be clearly seen in both the transverse and sagittal plane. In addition, there is also obvious thickening and edema at the mucosa of ethmoidal and frontal sinus, and multiple enlarged lymph nodes can be seen on both sides of the neck. The reason of conducting examination of nasopharynx and sinuses for COVID-19 patients is that some mild COVID-19 patients have no obvious symptom, but they have obvious abnormal symptoms at upper respiratory. Based on the current study, patients may show positive results of nucleic acid testing in early stage of COVID-19. Even milder or asymptomatic patients are also infectious. Therefore, we believe that MR cyanosis imaging can provide a relatively objective evidence. In addition to imaging directly related to the infection of COVID-19 or examination of its complications, some patients may have cerebral ischemic stroke and cerebral hemorrhage during hospitalization. With good disinfection, isolation, and protection measures, we can conduct different paths imaging for COVID-19 patients under the guidance of hospital infection control. This is a head MR of COVID-19 patient. Finally, the prospect of MR application in post-epidemic era. MR can be used for myocardial and hepatorenal imaging. For example, we can follow up patients with sequelae of myocarditis after treatment. Multi-parameter liver imaging can be used for the evaluation of drug-induced liver injury. Also, three-dimensional isovoxel thin layer HD imaging of abdomen can also be used to understanding the situation of abdominal complications. Finally, common abdominal examination can be performed through abdominal 4 sequence for free breath imaging. That's all the information today. Thanks for your attention.
It's the closing remark times. It's a great honor for me to enjoy this course. Thanks Professor Fu Haihong, the president of CSIT, and Yadin David, the former chairman of the International Federation of Medical and Biological Engineering Clinical Engineering Division, IFMBE, CED. The Professor Fu Haihong shared radiological technologists' professional practice for COVID-19 in China. With the effort of our medical workers, COVID-19 is under control. Gained valuable experience from CSIT. Also, the Professor Gao Jianbo shared the prevention and control measures in Radiology Department for COVID-19. Medical image examination COVID-19 has made many contributions to clinical diagnosis, so prevention and control measures in Radiological Department for COVID-19 is very important. Dr. SHAN Fei shared MR application in COVID-19. Thanks for all speakers. You are heroes. Let's share the courses and share it with the world. Thank you for listening. Thanks the organizer, the General of China Medical Device. Thanks the co-organizer, CSIT and International Union of Clinical Engineers. This program is exclusively sponsored by United Image Healthcare. We are also deeply grateful for their contribution and engagement. We fight COVID-19 together. We are family!